Namaste. Myself, J.V. and Shilpa Thakur, Assistant Professor, Faculty of Pharmaceutical Science, Jayati Vidyapith Women's University. Today's our subject is Social and Preventive Pharmacy, and the topic is Sociology and Health. Today we will talk about sociology and how the sociology is related to the health. The term sociology is derived from Latin word that is societas, which means society, and the Greek word logos, which means study or science. So it makes that sociology means the study or science of society, systemic study of social activities, societies, and groups is called as sociology. In this sociology, systemic study is included of the social activities that are carried out in the societies and the groups that are formed in our society, that is known as sociology. It involves the study of human groups and social behavior. In this, we will discuss about types of sociology. There are two types of sociology, that is microsociology and macrosociology. Microsociology is the branch of sociology which deals with the study of small units or groups within a large society. In this, the large society is divided into minute small groups, and these groups will be studied in these small groups. Sociology will be studied, and these sociology will be related to the health, as in this sociology affects the health. Macrosociology, it is the branch of sociology which deals with analysis and study of societies in that totality. Here, the entire society is studied. In this, we study how the entire society is affecting the health, and in microsociology, we divide the entire society into small individual groups on many different bases in small units, and then these small groups are studied, and these small group sociology is connected, as in this small groups of health is affected, how the health is affected of these such small groups, and how these small groups sociology or these small groups health will be connected, and entirely the total societal sociology is studied. Social and cultural factors. Social and cultural factors related to health and disease. Many factors that affect the health, the place where we live, we work, we learn, and we play are the social determinants of health, and these conditions can affect the health. Uh, in this, we will study about the factors that are related to the health and disease. Many factors that affect the health, whereas simply we can say the place where we live, where we work, we learn, or we play, all these places, all these factors are included, as in these the socio-cultural features of all the entire places will affect our health in a positive or in a negative way, and these conditions, as in, can affect the health in a better, for betterment or for deterioration. Several other factors that are education, income, access to healthcare, family, culture, environment, etc., are also included in socio-cultural factors which can affect our health and diseases. First, we will discuss about first, let us talk about education. If a person is educated, if a person gets education, it gives you confidence to take better decisions in life regarding health issues. It can encourage an individual to participate in various activities, that is like yoga, exercise, regular health checkups, and generally educated people are aware about health issues and avoid bad habits. Here, if a person is educated, if a person gets better education, uh, if each and every person has in general education, he will feel confident, as he knows everything and he will feel confident to take decisions of his life by his own. In taking such decisions, he will also be become aware of the different health issues which are ongoing in the recent society. These health issues are related to many present problems. These health issues can affect our life very badly, and that person will also get the education of some activities which can help him cope up his health, or which can help him to cope up with the uh, personal development. These activities like yoga, he can go for exercise, regular health checkups can be done so that he can know the health, how his health is moving forward, how the health is being becoming better. And generally educated people, uh, if a person is educated, obviously he can be easily made aware of health issues, and he can also be made aware that what are the bad habits, and that habits can be avoided, like tobacco chewing, like smoking, etc. Next is income. Healthy people have capacity to seek good medical supervision, but in case of the wealthy people, they are very lazy and inactive and more prone to various diseases like cardiovascular disease, diabetes, obesity. Once we talk about income, healthy people, obviously they are aware of the health issues, so that they will go for good medical supervision and they will surely look after their own health. So it will be a plus point for them. And the socio cultural factors, so the social and cultural that is around them will also be affected as with their positive attitude. But as we go for the wealthy people are many times seen to be inactive, or many times seem to be lazy. And this inactiveness or laziness can lead them to many diseases like cardiovascular diseases that are related to the heart, diabetes, obesity, etc. Access to healthcare. Educated and working people enjoy better health, but some people do not have access to healthcare due to less income or unemployment. Healthcare is needed by all and should be a facility to each and everyone, as it is a necessity for everyone. Educated and working people enjoy a good health as they are aware of each and everything, as they are aware of the health issues and how to help themselves to get out of these health issues. But some people who have less income or who are unemployed cannot gain that better health, cannot gain that facilities, as they are unaware, or they cannot afford to pay the amount for the health issues or for the tests or health checkups, etc. Family is also considered as a factor. Genes control the health of a person or individual. Some diseases like mental deficiency and diabetes are habit, sorry, are habit are hereditary problems, and the objective is to treat diseases, protect from illness, and promotion of health. Next is culture. Culture means people's lifestyle. Culture is a person, how he stays, how his habits are, what his behavior is, his friend circle, his family, society, etc. Culture means people's lifestyle, behavior, friend circle, and also habits. Number of diseases like cancer, diabetes, and heart diseases are associated with the culture of the people. The culture a person follows will be a deciding factor towards which a person is leading his life to go towards health issues or towards a betterment from the health issues and away from the health issues. Next, we will talk about environment. Environment. Diseases are generated by change in climatic conditions. Impact of urbanization on health and diseases. Now, uh, what is the effect of urbanization on health and disease? It is defined as state in which society is transforming from rural to urban, and it contains increased population living in urban accommodations, increased percentage of the population busy in non-agricultural activities living in such places. So in urbanization, we are looking forward to, as the population is increasing, as everyone needs a better life to live, or as everyone wants to move ahead or move forward, uh, the society is moving from rural to the urban areas. Many people are moving from the rural areas to the urban areas. These rural to urban movings will cause some things like increased population in urban areas. Urban areas will be flooded with populations. A lot of people are in India. There are many people living in the rural areas. So if many people are transforming from rural to urban areas, then there will be a flood of population in the urban areas. If these urban areas are accommodating more, so the population is busy in non-agricultural activities, right? So the agricultural activities will be lessened. So that will also create a different impact. So the impact can be seen on health inequity and mental health depression, health hazards due to poor water supply and sanitation due to increasing urbanization. Health hazards can be seen as because the water supply will be poor and sanitation problem will be poor, as there are a lot of people. Poverty and health. Here, poverty is defined into two different types, that is absolute poverty and relative poverty. Absolute poverty is defined as a situation where family income is inadequate to buy basic things of life. Means a family is working, but the income is not sufficient so that he can get basic necessities, that is house, uh, to eat, eating, things to eat, to wear proper clothes, or to stay a proper home. Relative poverty is defined as economic imbalance in the location or society in which people live. Relative poverty relates two things. So it will be the study of an imbalance of the economy between the society and the location where the person is living. Main cause behind poverty are main causes that are considered for poverty, that is unemployment, lack of education, rapid population growth, and moral culture. Effects of poverty on health. What kind of effects can be seen on health or effects on society? That is, poverty effects on health will be seen on the society due to homelessness, due to child labor, and the stress conditions. Next, effects on health of poverty, that will be the problems from poverty, that is due to the malnutrition. Effects on economy, whether the economy is powerful enough to generate sufficient jobs and facilities for people or not, is the basic question of the persons that will be poor or not. Next, some important steps can be considered to decrease poverty. First, increase employment opportunities. And second, encouraging self-employment plan and strategies. Here, many plans and strategies already have been encouraged so that a person is self-employed doing a small own business, that is like the old cottage industries that were going on in India. Fulfill the primary needs of the individuals like food and clean drinking water. At least every person gets good food to eat and a clean drinking water to drink. Improve subsidy rates on commodities and public distribution system. All facilities of health centers should be provided by the government. Free educational facilities should be provided by government, and promoting awareness regarding birth control. So these were the some important steps to decrease poverty. And the topic that was sociology in health means how this society is related, yeah, how this sociology creates an impact on the health, which is a major issue and can be looked at. Thank you.